Good morning, everybody. Today I just want to talk a little bit about what is chiropractic care. So what I'm going to read off here is actually the statute of Minnesota, and what it reads is chiropractic means the healthcare discipline that recognizes the innate recuperative power of the body to heal itself without the use of drugs or surgery by identifying and caring for vertebral subluxations and other abnormal articulations by emphasizing the relationship between structure and function as coordinated by the nervous system and how that relationship affects the perseverance and restoration of the health. So a lot of big words in there, and what does that mean and how do we do that here in Skrien Chiropractic Clinic? Well, for me personally, I was helped through chiropractic care, as I noted in a previous video. Arm and leg had gone numb, had headaches, kind of always struggled with attention deficits. My immune system was knocked down. But we found a chiropractor that did the Gonstead system of chiropractic. So today I'm going to spend a little bit of time about that and how I got trained in it and what's it entailing. Dr. Gonstead, he developed this technique years ago, and he had a system that he used in order to find these vertebral subluxations. So we'll kind of go through all of that with you in a little bit. Now for myself, I had got training actually by Dr. Troxel at the Troxel Chiropractic Clinic. And down in 1993, I was an intern there. And what was involved is that we ran classes for other students. And in order to do that, we had to take those classes to start with. And this was on top of our schoolwork. And we would do this after school, before school, and we had to pass some tests. And once we took those tests, we got interviewed by Dr. Troxel, and if accepted, we could be in the intern program, and we got to teach the other students, plus got to follow him around in his clinic and kind of be the exam doctor. So we got to be hands-on, learn how to find and take x-rays, how to use surface EMGs, and just how to operate the clinic. It was a very valuable service, and I know I came out being a good adjuster, understanding how the body worked and how chiropractic could actually help people in their health. Now, besides being an intern, I also took a number of seminars in the advanced Gonstead system, and I was recognized in 1993, before I even graduated, that I had completed the prescribed studies that worked for the Gonstead system of chiropractic. I had got this award right before I graduated in July of 1993. So what are the processes that, as a Gonstead doctor, that I'm looking for when I'm treating a patient? First off, we're going to do a detailed history. We want to find out what's bringing our patients in, what symptoms they have, and that way that's going to help us kind of hone in on where we're going to want to look as far as where these subluxations are. So as you can see on this chart, it does a good job in showing, we've got the spine back down in here, but then if we follow it over here, you can see the different areas, how it's going to affect our body. And then over here, kind of the symptoms that our patients can be coming in. So that way we can show the patients, is out, how is it going to affect their body? Now also, we can see on this, we've got the nerves here, and not only do they go, and cause pain, but it can affect your nervous system and how it affects your body, your heart, your lung, your intestines. Health care, and how can we remove that interference to allow the body to work the way it should. Now, one of the steps that we're going to do that to help locate that is we'll take x-rays. And the x-rays, it's going to allow us to see any misalignments in the body, if the curves aren't the way they should be, how thick the discs are, if there's damage being done to those, that we're going to do. Then we also want to do instrumentation. Now, in the Gonstead system, we use a nervoscope, and this little device here will run down the back of the spine, coming down in through there. And it just helps us where there can be some nerve interference. Now, besides that, I also do a couple scans, and I'll show you the instrument in just a minute here. I'm going to pause the video. So here I am, I'm back in my exam room, and in the exam room I have actually a computer system. And what this is, it's got actually a couple different sensors that will roll. One is a temperature sensor, and then one's a surface EMG. Now these are going to give me some readings. It's going to show me how the nervous system is working, if it's outside the normals, if there's an imbalance going back and forth, how the temperature is getting affected, and lets me get information on the nervous system. Now some patients we have to document for accidents and stuff like that, so we've got computerized range of motion, compare them to a normal, compare them as we're progressing through getting that range of motion back. We've got our x-ray machine right here, and it's a digital machine able to develop the x-rays and get them developed, and it comes right over into the computer over here, and a computer screen within a few seconds, and we can start to take. Hey everybody, yeah, I'm back, and what I want to explain next is kind of when the patients come in on each visit, we're going to be checking a couple other things. I'm going to watch how they're walking, or check their visualization, see if there's any imbalances in the level, like of the ears, of the shoulders, of the hips. How are they walking? Do they have a toe in, a toe out? Is there problems with the knees? And then also we're going to do some static palpation, where we're going to be able to see the skin in the back, see if there's any swelling, some edema, any areas on the skin that look a little bit different. Maybe they got some pimples along some areas, maybe there's a rash in some area, but just anything that'll visually give us a tone that, hey, that nervous system's under attack. Next thing I'm going to look for is we're going to do some motion palpation, and I'm going to be moving the patients back and forth, going to be feeling for the tone of the muscles. We're going to see if there's any swelling, see if there's any restriction of motion and how that is on each level of the vertebrae after we've done our scoping, so we know where to pinpoint. That way it's going to help us find where that subluxation is. Then we'll correlate it, see what it is, if it's correlating with what we're seeing on x-rays. And then we'll go ahead and give the patients the adjustment, the treatments for the day. Then kind of explain to them, hey, what to expect, what the next steps are, and when we'll see them again. So hopefully that's a little bit helpful. You understand a little bit more about the Gonstead system and how we treat our patients here, and we hopefully see you soon.